It's back to school time for millions of students across the country, and also a time when businesses want to bring back more employees. But it's hardly back to business as usual. So we're taking a look at how we can all stay safe with as little stress as possible. New York became the first city to mandate proof of vaccination to go into restaurants, gyms, theaters, and other indoor venues. Some employers are making it mandatory. It's a matter of safety for everyone, says Dr. James Schneider.
We're all in this together. This is not personal choice. This is public health.
Many boarding schools, as well as colleges and universities, are requiring students to be vaccinated to attend classes or live in student housing. In public school districts, it's different. Some are more strict than others, and many children are too young and ineligible for the vaccine. Mary Almonte says her youngest child has a safety routine, but the uncertainty of it all is stressful.
And he knows he's going to have to wear a mask, which he's been doing anyway. It's become second nature to him, sadly. But, you know, we still don't know what to expect if school is going to remain in session.
It's natural for children to have worries about whether going back to school will make them sick, says clinical therapist Dr. Elisa English.
And I think many children are concerned about their safety and, we don't necessarily have all the answers. So it's important for us to kind of think about what does that mean for them and how do we explain that to them?
Many parents and children are excited about getting back to in-person classroom learning. Wearing masks can greatly increase students' safety, whether they're vaccinated or not, says Dr. James Schneider.
Recommendations from the Center for Disease Control, American Academy of Pediatrics have made it quite clear that wearing masks is highly recommended because we know it's safe, we know it's easy to do, and we know it mitigates the risk, and it'll help keep kids in school.
Let's dive into this more with our panel and hear what they have to say. Joining me is Dr. James Schneider. He is the Chief of Pediatric Critical Care at Cohen Children's Medical Center. Dr. Schneider, thank you so much for being with us. We appreciate it.
Thank you for having me.
Thank you so much. Also with us is Mary Almonte. She is the founder of Young Urban Moms, and she's a mother of two. Mary, great to have you with us.
Great to be here.
Thank you so much. Also joining us is Dr. Elisa English. She's a clinical therapist. She works with many of the children in our school system. Dr. Elisa, thank you so much for being with us.
Thank you for having me.
Thank you. Dr. Schneider, as you look at where we are in this pandemic, this fall and this particular point, what are your concerns in general in terms of the children and keeping them safe?
Well, I think unfortunately we have to recognize that, as you said, this pandemic is not in the rearview mirror. And children are a part of this. And because we have this wonderful vaccine that's safe and effective, most children, school-age children, are not eligible yet for the vaccine. So we as a community have to really take a lot of effort to try to mitigate risk of getting them infected. And we do see kids getting infected, unfortunately. So we have to
feel that there's enough energy and kind of effort and momentum to try to get this right.
Well, I know there's a lot of effort in different areas, particularly in the school districts, trying to prepare to get back to school. I could also understand that this has been going on for a long time and we're all getting tired of this and kind of fatigued, and we'd like to get back to a normal sense of life. But I think shows like this will help to try to continue the efforts to help us get back to a safe, particularly a safe school year.
Okay, great. And we're glad you're joining us. We have a lot of questions, I'm sure. Mary, as a mom and having dealt with this pandemic and the whole, everything that's going on, what is your feeling about where things are in terms of going back to school and just having, some kind of normal life, daily routine?
So it's a mixture of fear, frustration, and I guess trying to hold out hope that there will be some type of normalcy. Last year, my daughter was in her senior year of high school. It was so disappointing. As a parent, I didn't even have answers, right? Every week I'd say, oh, it's going to get better. She was in school for about 2 months, hybrid. So it was like 2 days a week, very watered down, before they completely shut school down and this was in New York City public school, from, I want to say November until February. And then when they went back in March, it was back to like the hybrid kind of joke of a situation. All of the senior festivities were canceled. I took it upon myself to host the senior prom because there was no way I was letting my daughter miss a milestone that she was looking forward to since she was little.
Good for you.
Yeah, but I mean, a lot of anything that involved food and drink couldn't take place. So, a lot of like, they would have like a senior picnic and all of that was canceled. And of course, as much as I wanted to be super mom, I couldn't replace everything. Graduation was split into two. So she didn't even get to graduate with a lot of her friends that she went to school with since PK. So it was a really disappointing year. And now it looks like we're headed to another
More
one.
of this, like more of the same. Dr. Lisa English, you work with a lot of the students in the public school system, and with the children and with the teens. Where do you see their mental state right now with this kind of like, yes, it's okay, no, it's not okay, this is what you need to do, and then there's always this ongoing controversy in the just in all these public spaces and social media about what really needs to happen.
Yeah, absolutely. And I certainly want to give a huge shout out to the moms like Mary who are trying to make it work despite all of the lack of normalcy that is going on today. So thank you. This pandemic truly has created conditions that make it very difficult, Lisa, for people to feel regulated, normal and safe. I think she mentioned safety, and I think many children are concerned about their safety. And we don't necessarily have all the answers. So it's important for us to kind of think about what does that mean for them and how do we explain that to them? And then you add in certain historical references like systemic racism and distrust and equity and equality. And this can create the perfect storm for anxiety, fear, and trauma. And it's really concerning because if parents and caregivers and instructors, educators aren't necessarily regulated to do the work, how can they optimally serve children and families? And so I think it's important for us to be mindful of the youngsters that are eager to return to school, but that they also need information. And also we need to take lessons that have been learned from this experience. There's youngsters who have social anxiety, who felt bullying prior to the pandemic. And so this kind of virtual learning space for the most part has been helpful for them. So we need to also look at some of the lessons learned from all of it. But we do know the best place for students is in the school. And the best way to do that is to continue open and honest communication about safety and risk.
We have much more coming up right after this. Dr. Schneider, one of the big questions that a lot of people are facing right now is the issue of the vaccine. There's a lot of people that have been vaccinated, especially in the New York City metropolitan area, but there's still many others, and in certain communities, it's a much higher unvaccinated rate. How dangerous is that for everyone, especially considering where we're at in the pandemic right now?
Well, that's a really important point. And there are a few things that we know that are going to help us get out of this pandemic and really move on with life. And the best thing we've got is this very safe, very effective vaccine that we just need to try to get the word out and get as many people vaccinated as possible. That is going to be the best way to move forward.
Mary, how do you feel about the vaccine? And also, is your older child vaccinated?
So initially, I was very apprehensive about it. I mean, look, let's be real. As a minority, there's been histories of mistrust when it comes to vaccines and healthcare in general. And then even as a parent, right? Like a lot of parents that I know, especially in my young urban moms community, feel like vaccines lead to autism and other things, right? I know that there are studies that disprove that, but these are still things that are being chattered about and you just don't know. However, what kind of changed my mind is that my daughter, who is now starting college in a few weeks, was mandated because she's going to live on campus to get vaccinated. So like, if you're not vaccinated as a college student, you can't live on campus and you pretty much can't participate in 90% of the on-campus activities.
Right.
So when it became evident that she needed to get vaccinated, then I was like, well, if my daughter's going to get it, I'm going to have to get it too. So.
And Dr. Schneider, what about those concerns? What about those concerns that Mary has about, the vaccine? They're still out there despite all of the public information. We've done many shows on it. There's been a lot of public outreach about it, but how do you address those concerns? And both of you, please feel free to jump in and interact with each other as well.
I think those are common concerns that we hear. We've been hearing these concerns even before the COVID vaccine ever existed. The routine childhood vaccinations, that's always been something that we've had to manage. And unfortunately, there has been a lot of misinformation over the years out there. And the example brought up of the autism and certain vaccines. Sure, we know out there that there has been lots of information. In the medical community, we're very confident that there is no connection, for example, with autism. When it comes to vaccines in general, they're probably one of the most studied medical intervention that exists in history, frankly. Every vaccine that goes into any arm is monitored, is recorded, and is monitored for adverse events, side effects, for example. And so we know, and even with this COVID vaccine now, with hundreds of thousands of people having gotten them, we know very well the safety profile of this vaccine as well as all the other childhood vaccines. So I think it's really on us as the medical community to share the information, to reach out to all different communities to ensure everyone really understands the real science behind it, rather than the other piece of misinformation that is shared throughout different forums.
Mary, how do you feel about that?
And I mean, this sounds great, and I'm really happy to hear Dr. Schneider say that. I mean, it's kind of too late now, for us, regardless. But another concern that I'm hearing among like my other mom friends is about females, right? Like especially when it's our daughters who are like
Right.
yet to have children, or even other moms who are still in childbearing ages. A lot of people feel like there isn't enough research on how like your ability to have children or passing something along to your children, like there's a lot of confusion about that. Is there any research yet about that?
Sure, it's a great question. If I may jump in, Lisa, that because that was a very common concern, particularly earlier on in the vaccine distribution. Being a healthcare provider, I have many female colleagues, and when we were eligible, that was still really early before there were nearly as much data. But now, again, because of the thousands and thousands of vaccines that have now been given to women throughout the world, there again is now a lot of data that supports the safety of it, particularly when it comes to childbearing age women. In fact, recently over the last few weeks, the American, I forget the name of the Society of Obstetrics and Gynecology, they put out a policy statement supporting the receiving of vaccines for women of childbearing age, because again, the data that we have currently is pretty compelling. And even we have some data that the neonates, the newborns, actually also gain a benefit as well.
Mary, what about as we hear about this Delta variant coming out now?
So that is super scary, especially as a parent, because, and again, I could be misinformed, but this is what's going around.
No, let's get it.
among moms.
Let's clear it out. That we got Dr. Schneider here, and
Let's
we got
do
you.
it.
So let's
Yes.
Do it.
So from what I'm hearing, it seems like kids are actually getting more sick from the Delta variant as opposed to the strains of COVID that were out before. Is that true?
Dr. Schneider, what about that?
So nationally, we are seeing that the incidence of infections in children are definitely going up compared to earlier on. I think partly it's because kids are the most vulnerable, because the under 12-year age population, obviously they're not yet eligible. They will be hopefully soon, but they're not yet eligible. So they're unvaccinated, already at vulnerable. But we are seeing a very high rate of infection in kids. And yes, we are seeing kids get quite ill from this. This Delta variant has really changed the landscape of what we thought of. And so the things that we finally learned about COVID when it first appeared really is changing now. And so we're learning more constantly, because this Delta variant has really, it's shown to be quite much more contagious. And it seems to be more virulent as well, meaning kids and adults are getting sicker with it. More of a reason why this conversation is really important, to help spread the information that getting the vaccine is critically important, even if you've had COVID in the past. And because the vaccines that we currently have are effective. And the problem is, if we don't get this under control soon, at some point, nature will take its course and this virus will continue to mutate, because that's what viruses do. They mutate naturally, and then they may become less affected and really evade the vaccine protection that we currently have.
Mary, as a mom, how do you know when your kids are sick from something that is just, like something they'll get over, a little cold or a mild flu or something like that, or something more serious where you need to call the doctor?
Well, you just know when they're off their game, when they're not themselves, you know. But to be honest with you, it's scary no matter what, even if it's a simple cold. When you see your kids out of it, it's, you never know. Now, during the time of COVID, it's the first thought that's in your head, right? And so myself and my whole family actually had COVID, including my kids.
Wow.
Interestingly, my son, who is 10, had no symptoms. My teenage daughter just had a runny nose. And then myself and my husband were like praying that we didn't die.
You
So
were very sick. No, and I'm so glad I'm so glad to see you doing so well now and looking so great.
thank you. And thank you for your well wishes when I was actually going through it. It meant a lot. But
Oh.
yeah, I mean, so that's also a really scary and confusing thing too, because you're like, okay, everyone gets it differently. Everyone has different symptoms. Thankfully, I was so happy that my kids were not as sick as I was. But now with the Delta variant, it seems like it is hitting kids in a harder way.
Dr. Schneider, let's a couple of things. So is the Delta variant more contagious among children than what we saw with COVID-19?
Yes, in fact, that's one of the characteristics of Delta, which is making this a much newer kind of disease that we have to think of. And it's very different than what the original COVID infection was like. It's much more contagious.
And then in terms of symptoms, because that was the first thing, when COVID-19 came out, 2 months in, the fact that children were not large numbers of children were getting sick gave a lot of people, at least some comfort. But in terms of the symptoms, how do you, because there is a fine line. There's people that we've heard stories of these kids that they seem like they're coming down with the flu or whatever, and then like 6 hours later they're on a ventilator, in a pediatric ICU. How do you, as a parent, decide? Is there any combo of symptoms that parents should be looking for? Help us understand that.
Right. Yeah. That's the very challenging problem that we as parents face. Earlier on when this all started, as we immediately were masking and social distancing, all the other common pediatric or childhood infections, common cold viruses, other types of viruses that lead to bad respiratory or fever illnesses, they almost vanished. They really went away. And so kids who came in with fever, with breathing problems, with gastrointestinal problems, it was pretty likely that it was going to be COVID. And we had a test, thankfully, that became quite available. The challenge now is that all those other viruses, now that things have kind of loosened up a bit, people are out and about a little bit more, the strict use of masks have clearly gone by the wayside in a lot of public settings.
Oh, yeah.
And so and this is true not only here in New York, but across the country, across the world, we as pediatric clinicians, we are seeing an enormous amount of all those other viruses and all those other infections. And the problem is, as you alluded to, a lot of the symptoms are very similar. They overlap a lot. So really, essentially, any child who has cold-like symptoms, has a fever, may have coughing, wheezing, any respiratory symptom, has gastrointestinal symptoms like vomiting or diarrhea, at this point, you should just get yourself tested.
Mary, what do you say to some of the moms in your group who are just like, I'm not doing this, I'm not getting involved, I don't want to get vaccinated?
So, I mean, I know it sounds corny, but we really are all in this together. And yes, it is a personal choice, but your personal choice will impact everyone. So, it truly is an act of selfishness at this point to not take any kind of action towards, fighting this and really, being protected. And also, I mean, if you want to be selfish and take that approach, you definitely don't want to have COVID. I mean, I'm very vocal about my experience with it. It was not a walk in the park. And, I think that more people need to be honest. I feel like there's a little bit of a stigma too. I know people who had COVID and would hide it and don't want anyone to know. And it's like, I feel like the only way anything changes is by being honest and, sharing your experience. So.
No, and you did it publicly on your social media, which I think was really great for people and inspiring for people, because we all know all the great things that you do and, your lifestyle and everything. To see somebody healthy that is out there, and then to be able to get it, to catch it and go through such an ordeal. But we really appreciate you speaking out and having the courage to do that, because at this time it does takes a lot of guts to do that, I think, in this climate. Thanks for joining us for this episode of Street Soldiers on fall COVID concerns. If you'd like to share the show or watch it again, just go to our Fox 5 NY YouTube page. Remember, use your mind. It's your best weapon. I'm Lisa Evers. Let's push for peace, love, and health equity for all.